Hi, I'm Blake McKinney. I'm the co-founder and chief medical officer of SiriusMD. I'm a practicing emergency physician, and it's flu season, so I wanted to talk a little bit about that. I want to talk about telemedicine and what's a person to do. So this time of year, there's really two kinds of people. There's sick people, and there's people who could potentially become sick, and maybe they're worried about it. And in all of our communities, we have one of these. Everyone knows what that is. That's your clinic or urgent care or the hospital, and that's where the doctor is. Okay, for most people, that's the only place the doctor is. And so when you're either sick, or for many people, worried about being sick, you're going in there. And this is, I guarantee you, the place where all the germs are. And what we want to avoid for people is we want to avoid the not sick coming in and leaving sick. So let's talk about it. Why do people go in there? Yes, that's the only place the doctor is. And what else is there? You're thinking about tests. You're thinking about the ability to get a prescription. Fundamentally, what people want, and this is a good thing, is to leave reassured, to see the doctor, to get that assessment, and to ultimately, whether there are tests, whether there are prescriptions, to have that reassurance for yourself and your family. So no matter what the scenario is, you have a concern, and that concern is real, and we want to be there for you and to get involved, to understand, and to help you through this. I'm going to share with you the physician's flu algorithm, and this is lighthearted, but this is an internet source unknown algorithm that's been out there circulating around for a while, and I want to walk you through it. A doctor might just ask you when trying to figure out if we're dealing with the flu, do you feel like you've been hit by a train? Well, if the answer is no, you don't have the flu. So let's get on to the person who says, yes, doc, I feel like I've been hit by a train. We're going to ask you the next logical question. Have you been hit by a train? Because if your answer is yes, then the diagnosis is that you've been hit by a train. If the answer is no, however, you have the flu. So it is what it is. There's a lot of it going around. And let's talk about what we do. So a lot of us have been through some flu outbreaks, and we remember that there is a test that goes through your nose, down to the back of your throat. Nobody likes it. There's a medication called Tamiflu. It's out there, and the word is it can help your symptoms a little. Maybe it can. Either way, when the doctor gets involved and they listen to your story, they're going to make a plan. We're going to talk about reassurance. We're going to talk about whether you're a person who maybe there's some diagnostic uncertainty. The test will be helpful. Maybe you're a person with asthma, maybe you're pregnant, maybe you have another reason to be compromised from an immune perspective, and we're going to take the safer road with you and try to protect you at all costs from all the symptoms of the flu. Either way, that's why people are going into clinics right now, and the well are putting themselves potentially at risk. I want to talk about a different option, and that is for many people. I'm going to say at this point, for most people, there is a way to interact with a doctor, to connect with a physician who can listen and understand on your phone. Everyone's got one of these in their pocket, and when we think about redirecting both the sick and the concerned to see a doctor, to talk to a doctor, whether it's by chat or voice or video, and to get that first up assessment, what we're going to do is actually block a lot of the asymptomatic people who are concerned from ever putting themselves at risk in a clinic. And we're going to block some of the sick people who may or may not need to be seen in person from going in. And we're going to identify and we're going to invite the truly sick who need to be potentially hospitalized, who need to be in to be seen for that in-person visit, into the clinic where we want to see them. And in doing that, we're going to keep a lot more people healthy. We're going to stop a lot of people from having to uplift their well children and dragging them in to the clinic. And ultimately, we think we can improve on the outbreak of a flu or a contagion of any kind by giving people the ability to have a doctor in their pocket who can get involved, make that assessment plan. And I'd just like to ask the doctors of social media and patients who are out there, people with experience, to come onto the comments and let us know your thoughts and talk to us about experiences you've had or that you'd like to have. And again, my name is Blake McKinney. Thank you very much.